Welcome to This Week in Health IT Influence, where we discuss the influence of technology on health with the people who are making it happen. Today, Tressa Springmann, CIO of Lifebridge Health, joins us. That is out of Baltimore, Maryland. And we talk about a lot of things. Actually, we bounce around a lot. I love having conversations with Tressa. But we spent a fair amount of time talking about digital and digital projects and how you get digital projects done as the CIO. So great conversation. My name is Bill Russell, former healthcare CIO coach, consultant, and creator of This Week in Health IT, a set of podcast videos and collaboration events dedicated to developing the next generation of health leaders. I want to thank Sirius Healthcare for supporting the mission of our show. Their weekly support of the show this year has allowed us to expand our service offerings to the community, and for that, we are incredibly thankful. Quick update before we get to the discussion. Starting in 2021, we have a new channel. Okay, so if you're wondering, This Week in Health IT is a channel. We have 3 shows on that channel. We have Newsday, we have Solution Showcases, and we have Influence episodes where we talk to industry influencers. The only change you're going to see on that channel next year is that the Newsday episodes are now going to be duets. We're going to have a series of about 6 guests that come through and talk about the news with me. So instead of just me talking about the news, it's going to be conversational with different people with different perspectives. We're going to have a physician, we're going to have CIOs, we're going to have former CIOs, and we're going to have a startup, former CIO or CEO of a startup be one of those guests as well. So we can talk about the news from different perspectives. I think that you guys have responded really well to that and given us great feedback that you appreciate that dynamic of going back and forth on the news. So we're going to continue to do that. But you've also told us that you love the Newsday show. And so what we're going to do is we're going to be launching a new podcast, a new channel in and of itself called Today in Health IT. And this is where I'm going to talk about the news, but I'm going to do it in much shorter segments. So what you're going to get is we're going to release a show every day of the week. So Monday through Friday, weekday. Every weekday, we're going to release one show. It's going to be 5 to 7 minutes in length, and we're going to cover one news story. We're doing this based on your feedback. You have said shorter segments to help you stay up on the news. This way, you can just put it on your podcast, listen to them all on Monday, listen to them all while you're working out, or just listen to one a day for about 5 to 7 minutes to stay current on what's going on in health IT. That is going to launch in January. We are going to start doing the daily episodes on Today in Health IT. But you can get signed up today. You can go out onto wherever you go for your podcast and sign up for that. And as soon as we start releasing shows, it will start showing up in your podcast listening device, whatever that happens to be. So thanks again for your support over the years. Again, we want to get this content into as many hands as possible. So share it with your friends, and we really appreciate your support. Now, on to our discussion. So today we have Tressa Springmann, the CIO for Lifebridge Health, with us. Good morning, Tressa. Welcome back to the show.
Hey, Bill. Great to see you, and thanks for having me again.
I'm looking forward to the conversation. There's always things happening. And it just sort of struck me. We've had you on the show several times, and I'm not sure we've done this. I actually got some emails from my listeners that they want me to start with this question. Hey, give us a little background about your system. And we may have covered it before, but for those who just joined us, give us a little background on Lifebridge.
Yeah, happy to do it. Lifebridge Health is an integrated delivery network. We've got 5 acute care hospitals. They're all in Maryland. A number of them are near Baltimore, but we also have one in Carroll County, which is relatively rural. We have a few nursing homes. We've got over 30 urgent care sites, a few thousand physicians, of whom about 600 are employed. We have a for-profit entity that has a lot of joint ventures, whether it's outpatient pharmacy, physiotherapy, we have hospice, we have home care. We really have something across the continuum. But you know, Bill, as a lot of people kind of count hospitals, and certainly our hospitals are a very proud element of our continuum. And as I said, we've got 5 acute care hospitals.
Are you so you're the CIO of all of that? You're the technology leader for all of that?
Yeah, yeah. I'm the technology leader for all of that. I also am responsible for HIM, the medical records function. I also am responsible for our telehealth construct. And that was even pre-COVID, but of course that's kind of gone on steroids. I have a couple of teams that manage call centers. One is in Manila and one is in Jerusalem. And that complements very nicely with our digital strategy. And I know you were interested in talking a little bit about that today as well.
Yeah. What's interesting, we didn't have any nursing homes where I was the CIO. Is that a different suite of technology products than you would have, say, in a hospital?
Yep, it sure is. Just like the Cerners and Epics of the world, the long-term care community really has consolidated on a tool called PointClickCare. And they're kind of the big gorilla in town, and it is very different technology. The same is true with hospice. Hospice has just a handful of key EMR vendors, and again, they've got just some really unique needs based on the environment and the care that they serve in their own patient community.
Just for fun, I ask this question for CIOs from time to time. How many applications total do you have across your continuum?
I don't know. I probably should be able to answer that, but considering the probably 25 contracts that are on my desk to review, because end of calendar year is always a good deal.
Yeah.
Oh, I'm sure it's over 400, and yet the 80-20 rule always applies. I'm always looking for a platform play because it's really those key platforms that are the accelerants to the organization. And most of the time, and I think the platforms that I would focus on include your EMR and all their boundary systems,
yeah,
your ERP and all of those boundary systems, your Office and Office productivity and collaboration like O365 or Google, and then the whole advent of digital health and looking for a platform there and integration with CRM, everything that is very consumer facing, which is a real new pivot for healthcare.
Yeah, we had upwards of like 900 applications. How do you keep track of that? So we had a CFO for IT. I mean, when you have a 200 some odd $1 million budget, that's what you end up doing. And that CFO role, he put together a calendar. He put together a contracts calendar for throughout the year. And it kind of cracked me up because I was looking at it, I'm like, oh my gosh, we renew at least like 10 contracts every month, at a minimum, 10 contracts every month, which gives you I mean, we could just have a full-time part of the CIO role being contract negotiation to a certain extent. Do you guys, what do you do to manage your portfolio of contracts?
Yeah, we actually have a system that helps us do that. So we've got a system where we scan and index all our contracts, and the index includes renewal dates, when they're coming up, etc. Your point's a good one, which is there are weeks when I feel as though I am nothing more than an extension of the legal team, because there's always quite a bit of activity going on in that space and quite a bit of opportunity too. So that's usually a very, depends on your own culture, but for me in this culture, it's been a very large part of my job.
What's interesting, I just finished, I finished part of my work is consulting. I just finished a project talking to some health systems about their structure, and at least two, maybe three of the academic medical centers have now added legal portion. A person reports into the CIO, either because they're generating so much intellectual property, they're doing contracts, those kind of things, but they have a full-time legal person in the IT department.
Yeah, we're not structured that way, but I have a person too, and she's wonderful. And she really straddles innovation and IT because of all the nuances of the risk that that those kinds of acquisitions surface, and really the need to have legal counsel that is very comfortable and familiar. The whole IT security proposition and limitations of liability and how much insurance. And I mean, it's become a very real thing and a very specialized role. So although Addie doesn't report to me, she's a shared resource and I fill most of her days.
Yeah, it's interesting. A lot of times we dealt with outside counsel. So for me, it was helpful because I could always, when you're dealing with outside counsel, you have a team of people so you can pull in the right person for the right thing. You're probably wondering if I'm ever going to get to some of the stuff I sent you over in the email. So I'm
No.
You know, this is what I like about talking with you, Tressa. I mean, we could go in a lot of different directions based on what's going on in the world. But one of the things I did want to talk to you about, again, is a little bit the structure. Do you guys have a chief digital officer at Lifebridge?
We do.
Okay. Does that report into you or is it separate?
That is me.
Oh, it is you. Okay. So you're CIO, CDO.
Well, so Bill, I think everyone is really working through this, right? When we think of digital, and let's start with that definition, what does that mean to your organization? And how do you want to accelerate it? We've been on that journey ourselves. We've been working on a digital strategy and what is the best organizational structure for that and how to support where we are today and where we need to grow. I think you've been a CIO. One might argue that the digital ecosystem, and let's just for argument's sake say it's anything that is smartphone enabled and complemented by the web. It's really about the audience and the support structure. And so if we're digitizing a tool for employees and you already have a team that's supporting HR and payroll and OC health and your employees, that having tools that are just using different technology and maybe are smartphone enabled fit nicely into that. And frankly, I want those associates to grow into the world of new technology and not bifurcate a legacy team and then a digital team. The same is true with our providers, with our nurses, with our doctors. I have clinical teams. They know them, they work with them, they understand them, and they want to grow in the digital space too. The real unique entrant here is the consumer as the user. And it's everything from setting up a support structure. So if that consumer has a question about the tech that we've given them, that I have the same service center capability to help them as Amazon might, but also having a group that's very consumer tuned. In healthcare, one of our tiniest departments usually is marketing. Yep. Right? Marketing is usually the small department, and yet now we have the advent of the very discerning consumer in the healthcare space, and we've got to develop a capability to put these tools directly in their hands and then do a good job supporting them. So in our organization, like many, we've been navigating this question about, is it a CDO? Is it part of innovation? Is it part of marketing? And at the end of the day, the only thing in our philosophy that differs is who that end user of the technology is. And it's the consumer, and it's just a new user group. I mean, 20 years ago, you and I, we automated all of our back office function and we dealt with all the administrative people in our health systems. 10 years ago, oh my goodness, we now had to do the same with our clinical users. And many of us hadn't even done much interaction with clinical users until CPOE and the EMR, etc. And here we are, we're just a new user community. So how do we do that and do it well? I participated in a forum recently, I believe it was by the Chartist Group. And interestingly enough, the leading indicators for CIOs, and this was across all industries, they asked across all industries, what is the CEO's priority for IT? And the number one priority in this survey was to lead digital business and digital transformation initiatives. That's what the CEOs across all industries are looking for from IT. So I think we're all trying to accelerate it and maybe approach it differently. But 10 years from now, how can it not be supported out of the function of an organization that understands the technology?
This is really, I'm going to camp on this for a little bit because I think it's really interesting to me. It's so when I was CIO, I had to, it was interesting because marketing and strategy were making a play for we own digital because we are the ones who are closest to the consumer. So they wanted the budget and they wanted to select the technologies and whatnot. So that was a place where I had to partner.
Yep.
And by the way, I essentially, I was the CDO within the organization. And I didn't mind plays like that because it meant people were engaged. They had ideas, they had solutions. You just had to, you had to figure out a way to organize them. And once you organize them, then you were going to get the great solutions, people excited about moving it into the organization, those kinds of things. But marketing was the interesting thing to me in that they really wanted a strong say in it. Operations wanted a say in digital, but only because it was so integral to, I mean, everything we do is digital now, right? And so operations was sitting there going, look, this is going to touch supply chain. It's going to touch our physicians. It's going to touch every aspect. So they wanted a piece of it. They didn't want to own it, but they wanted a seat at the table and to participate. What does that look like? And by the way, I have found very few marketing departments in healthcare. And I've worked with a lot of healthcare systems. I think it's the weakest department in most health systems. And now I said that, you didn't say that. Don't get mad at Tressa, get mad at me. But generally speaking, they haven't built this muscle. They haven't flexed this muscle of really engaging the community in a way that usually it was get the ad at the football stadium and the baseball stadium, get some billboards, send out the mailers, those kinds of things. That's what it was for decades. And then all of a sudden digital came along and they had to develop a whole new set of skills. And I think that's evolving, but it's still one of the areas I think was weakest. But anyway, the question is, who do you partner with on this? Who are the key partnerships for you?
Definitely our chief clinical officer and our chief marketing officer. And I am really, really lucky. Our chief marketing officer came to healthcare, came to our organization. This is his first healthcare job. So, of course, he thinks we're backward and archaic. He's been in the consumer space. I think he was with Target. He was with some banks. And he could completely do this. But, you know, when we talk about digitizing the consumer experience, his purview is SEO, search engine optimization, CRM, campaigns, all the right things. I think he would be very effective at leading a lot of those digital activities, and in fact, he does. I think he would not say, I'm the chief digital officer, and I think he'd like to continue to grow that function. But very quickly, that digital experience creeps into operations, whether it's online bill payment or whether it's scheduling an appointment or whether it's having a digital remote patient monitoring post-discharge to know how your care experience and your pain were. And very quickly, you get into a purview that marketing's not interested in, because they're all in the sell end of this. They're not necessarily in the operational end of this. And so, like IS, we very historically have been in a cross-continuum position for that. Look, I think it's more about the individual than where it's placed, but just like population health, just like telehealth, at some point, these places that we need to go in healthcare to take care of our communities, ultimately and over time, if they don't back in to becoming the focus of the IT structure, then I think you really need to challenge yourself on what's your IT structure doing for you.
Yeah.
You know?
So, yeah. I mean, let me go one step. There's a lot of health systems that have created digital teams, and let's define those as people who come into work every day and their job is to focus on digital initiatives. That is to focus on where the consumer meets the healthcare organization, or overlaying a set of tools for clinicians to interact with those patients. And it's not just, obviously it's not just patients, there's other communities, clinician to clinician communication, those kind of things. But there's a group that comes in every day and says, I'm going to focus in on enhancing the patient or physician experience through digital tools. And that's their role, that's their full-time job. Do you have people that it's their full-time job, that when they come in the morning, that's what they're thinking about?
So we have a number of them, but they are not in a centralized team. And I believe through recent discussions and our own roadmap planning that they will be consolidated into a probably pretty small but mighty team. And it will be a consumer IT team, a digital consumer team. As I've mentioned, we already have teams that have great relationships with our clinicians and great relationships with HR, AP, our associates at large. And those are the individuals that they come in already, Bill, and think about how to make the payroll or the supply chain or the nurse's day better. I don't know why I would want to set up a separate structure for that. They already have the user relationships, and as many of the application vendors, the digital solution oftentimes is just an extension of the core product anyway. Yep. But it's this digital consumer space where it's a gap, where we don't have a service center for them to call, where we don't have people who are coming in from retail or other industries who know that digital first and really smoothing those friction points are really what allow you to grow your customer base and then keep them and keep them in a loyal fashion, because the technology choices you're offering aren't creating such friction and frustration that they go elsewhere. So again, we have a few people in the organization who have been very involved in our early digital projects. And over the next 60 to 90 days, we're going to be probably centralizing them, consolidating them, giving them a name. But again, I went through this exercise a couple of years ago, one of those self-reflections where you're really digging into what are you good at and what do you like? And how do you come up with a personal mission statement that really is an archetype for what you like and what you're good at? And I did it way too late in my career, Bill, but basically I am an ideas to outcome architect. I love to take a concept or an idea and figure out how to fit it into a culture, because there aren't any right or wrong. It's just what's going to work. And I don't think the digital consumer is no different than the idea to outcome I had to implement so that we had an effective population health support structure or telehealth support structure. This is just that next thing.
Idea to outcome architect. That's brilliant, by the way. I love that.
Well, it was one of those like team building, and you go work with people offsite and you use some of those very cool tools and really try to make very precise what your passion is and actually what other people think you're really good at. And then you got to put it in a talking point for your elevator speech. But I embrace that. It's really what I like to do. But it also means that what I am not as good at is really just day-to-day operations, because I like to build things. I'm a builder and a convener, and taking something that is maybe fragmented and evolving and really giving it governance and structure and legs and getting it implemented. And then I like to move on to the next thing. So again, very similar to where you would position digital. That probably means that wouldn't position me for a lot of like positions in other organizations who want someone who's really good at just driving the train.
Well, you got to exercise that capability a fair amount over the last 9 months. Ideas to architect, probably at a pace and speed at which you haven't been asked to do it before. What are the kinds of digital projects? I mean, we could talk about work from home and telehealth. We probably will touch on telehealth, but what other digital projects were in high demand as a result of the pandemic for you guys?
Yeah, it's interesting because there are 4 things that I talk to my staff about right now, really to keep them updated on what's going on with this pandemic. And the 4 categories are capacity, staffing, visitor management, and vaccine. And I think a lot of what we were doing, Bill, just became highly accelerated from a digital perspective. And part of it was just out of necessity. People were afraid. So whether it was all the social distancing, visitor restrictions, etc., or the stay at home, the work from home, never waste a good crisis. And really, necessity is the mother of invention. And we've seen it. So I probably have nothing new to offer. Work from home has been a huge area of accelerated activity, and it'll be, for many health systems, an area of performance improvement dollars. We've moved 1,800 people off-site, and 80% of them are going to stay off-site, and we're going to start shedding rented space to bring it to the bottom line. Now, we make no bones about it. We're making some significant technology investments in the security of that work from home structure. So this isn't a big windfall for us. We just need to make some investments in other areas. But this crisis has catalyzed so many things for us that, frankly, had been considered in the past. It just became an accelerant.
So it was capacity, visitor management, vaccine. What was the 4th one? Staffing. Okay.
Staffing. Yeah. I mean, look, a lot of us have seen clinicians retire or because of their own health not withdraw themselves from the community, and with full census and length of stay because of how long it takes to really manage a serious COVID patient to discharge compared to what they're used to, our clinicians are just exhausted. And
does technology play a role in helping to address the staffing burden for the health system?
It can in many ways. If people are using tap and go to get in and out of their systems, we're having discussions now, Bill, now that we're seeing another really high wave here of COVID in Maryland, where early on we got iPads deployed. We really tried to lean into this concern about visitors and visitor restrictions and the isolation and just the sad stories of not being able to be with loved ones during a very challenging physical time for our patients. But now we're thinking about it a little differently, because what we learned is this was a huge burden for bedside caregivers. They couldn't just do their clinical job. We expected them to be the tech and guest service at the bed also. So now we're really rethinking that, and we're coming up with different ways to continually pull the non-value added, non-clinical work off the bedside caregivers.
Yeah.
We've accelerated a deployment of an in-room engagement platform, again, so that if the room's cold, the patient is letting facilities know to come fix it, instead of it always ending up right in the nurse's lap to try and deal with it. So it's just accelerated a lot of things.
What does vaccine, I mean, you have it as one of your categories. Is there preparation? Is there tracking? What kind of things are you looking at?
Yep, all the above. So let's see. In fact, I have a meeting at noon to talk about vaccine preparedness. But actually, early on, it's going to be very critical that we have the right analytics in place and reporting where there can be complete visibility when we get those early aliquots, who's getting them, what was their reaction, how did they do, and making sure while it's early and in short supply, that they're going to the bedside caregivers who are willing to have them being the vaccine. So, right. Yeah, I would say for the last month, we've had a lot of vaccine planning in Maryland. I'm really proud of what the state here is doing. And I've spoken before about how we leverage our state health information exchange, CRISP. CRISP here in Maryland happens to also be, and I'm not going to get the term correct here, Bill, but it's there. We use a tool called Immunet, and Immunet it ultimately ends up that there are various state connectors for immunization tracking that loops all the way back to national tracking. And so it's really been a nice federation about how do we get our own EMRs that are sending vaccine data to our state HIE to make sure there's a complete line of sight. So once we start actually getting the doses on site, that we've already got the interfaces in place, that we have the core content in our EMR ready, because as you know, depending on what vaccine, it's 1, it's 2, it's 21 days apart, it's 28 days apart. So it's everything from updating the content in our EMR, preparing training, and understanding that the initial tip of the spear is going to be healthcare workers. And a lot of organizations aren't using their core EMR for their associates. They might have an occupational health EMR. So there's a lot of work to support mass vaccination, workflow, and then ultimately making sure that there is a good line of sight. No surprise, and I know you've heard this, it's a bit of a head scratcher, but in an already crazy pandemic time where IS is trying to enable the organization, there have been tremendous reporting requirements put on healthcare, and whether it's vents or ICU capacity, or everyone wants to know, and it's all kind of flowing down on the shoulders of what are to be some pretty small but mighty teams.
Right. Somebody asked me about it. You can correct me. You're CIO in the chair. And I said, I really don't have any sympathy for these large health systems because generating these reports is not all that difficult, to be honest with you. I mean, they have fantastic teams. They're already tracking 2/3 of the information they were already tracking. About 1/3 of it was new. And I understand that takes some time. You have to vet that. You have to get that integrated into the clinical workflow. But the large health systems with money and teams, I didn't really have much sympathy for. The medium size, I do have some sympathy for because you had to prioritize so many things and it's very difficult. But the smaller health systems, I don't even know how they function. They have to do that reporting. It's changing. They have to do cybersecurity. They have to do all the things that a large health system have to do. And then you had these added requirements. So for them, I had a lot of sympathy. But I mean, that was sort of my take on it. So where am I wrong? Where am I wrong?
I'm not going to push back on you. You know,
okay.
It's not been a crisis for us. We're a mid-market health system, and really large health systems, they solve it once and they can address it for many, many different hospitals. So I think your perspective is a healthy one, and it's very worrisome. It's like many of these other initiatives, asking ourselves, how do we keep healthcare local when it's the same catalyst, Bill, that drove a lot of physicians away from independence and into our corporate EMR structure. It just became too complex. It was fraught with risk, and they couldn't keep up with it.
I want to go back to something you said. So essentially, you guys have a registry for vaccines in the state of Maryland. That's essentially what you've set up. That sounds very effective to me.
Well, actually, each state has it. It's called the IIS network. I'm sure I've gotten it wrong. So for those who are connected to this, I apologize. But there is a national vaccine registry, and each state has, it's like this great network diagram where each state has an IIS and a connector locally to the national immunization network. And in Maryland, it's called Immunet, and it's actually sponsored through our state HIE, CRISP. So again, the United States as a whole, this is an area from a public health perspective where they're pretty well positioned. Now, it's just like kids' vaccines. It doesn't mean they're going to get their kids vaccinated. But in terms of a nice local, state, and national network, it's already been in place. In Maryland, the value there is that if your child presents, let's say they have an acute episode of some sort, and they present in a hospital via AMBO, unconscious, that ER physician, if needs be, can access our state HIE to see, was there a recent vaccination? Was this a reaction to something? Because for us, it's all accessible and available because of the HIE. And the reverse is true, which is this child was not immunized for that. So it's just another essential data element. I think it was largely put into place, right, for children and school-age children. But in the case of this pandemic, it's really going to be incredibly beneficial.
Are you guys working with like your marketing teams? One of the things, I just had a conversation with somebody who's out of state, and it's an epidemiologist, and they were talking about how much misinformation there is out there and how important it is to get the right information out. And we think, oh, they'll get that through the news channels. But the reality is the people who are trusted most about health is the doctors. Is your health system marketing and team working on how to get the message out from you to the community?
What message? I mean,
the message about vaccines. This vaccine is, nothing has ever been as politicized. This is the craziest politicization. If you're on the progressive end, you might not get the vaccine because you're like, well, this was developed under the Trump administration. I've heard this, by the way. It's developed under the Trump administration. I don't trust it. If you're on the conservative end, you might not take it for various reasons. I wouldn't say conservative end. I would say the right-wing end. You'd say, hey, there is no issue here. I'm not doing the vaccine. And then you have the never vaxxers and all those other things. Right. I mean, is there a role to play for the health system to get the message out?
So along those lines, yes. For example, we actually were able to get some grant funding, and we've got mobile delivery of COVID testing in some disadvantaged neighborhoods. And we have added to that the offer of vaccinations for the children in those areas.
That's fantastic.
Well, I think there's always an opportunity to try and educate. The reality, though, is the issue isn't always education, Bill, it's trust and or mistrust. And where does that mistrust stem from? And you're right, sometimes the healthcare organization is perceived to be the most trustworthy by the recipient, my doctor, my nurse, but in other neighborhoods, it's not. And that's where faith-based networks, it's like any other circumstance where there's got to be an understanding of trust. Yeah. I will tell you, what you're observing is spot on. I was in a conversation with a gentleman last week, and he said, is it really? I mean, are you guys really busy? Like, he totally felt that all news was fake news. And when I was sharing how full the hospitals in Maryland were now, and a month ago they were not, he just really challenged me on it. He's like, you're not kidding me, are you? I mean, I just thought all of that was like fake news. And I'm like, no, this isn't fake news. It's getting really tight out there. So you're right. And it is sad. And people need to get comfortable with where those trusted sources are. My observation would be that healthcare needs to do a whole lot more in this space. A lot of our clinicians, at least at Lifebridge, are fantastic about putting themselves out there to the public. But many are just so bright and so scientific that they don't connect the dots for people. But I do think it's about trust, and it's about believing that source of information.
Well, Tressa, you were the consummate professional. I took you way off the questions I was going to ask you. I do want to add, I want to pull us back to health IT to close out. And I've been asking a bunch of CIOs this, and the fascinating thing to me is I'm getting different answers from each of them. what do you think will be the lasting impact on health IT as a result of the pandemic?
I hope it's choice. For a number of years, we have appropriately recognized the role and the importance of the care provider. And now's no different. We do everything we can to make sure that our clinicians are very efficient, whether it's through voice recognition or ambient listening tools, etc. But sometimes I think maybe it has been at the choice of not offering the best solution to the patient or the family. And I believe that some of these innovations in technology are going to continue to allow the patient, the consumer, their family to have more choices about how they want to engage in their healthcare. And I think it will make them happier. It will lead to better health compliance. And the telehealth circumstance has proven that if it gets reimbursed, in many ways, it's not about the technology, because certainly the telehealth technology has, by and large, not been the problem. And our ability to continue to offer choices to the patients in our community to engage with us in the median and means which is of most comfort, whether it's in person or phone or video, as long as it's clinically appropriate, just that ability to offer choice.
Yeah, absolutely. Tressa, thanks again for your time. I know that you guys are really busy. Just so people know, this is being filmed the week of Thanksgiving. It's not going to air the week of Thanksgiving, so people might, when it airs in December, they might go, oh, well, things aren't that bad and whatever. So I just want to mark it with we are actually recording this, getting ready for Thanksgiving. Have any exciting plans for Thanksgiving?
Nope. Pretty traditional, except a lot smaller. And yeah, definitely we have a few folks who will be, they're local, they're friends, and they'd otherwise be alone. So we will be wearing masks, I guess, except when we're eating our turkey. But yeah, my fingers are just crossed. We are very full, and we've got a lot of activity going on. And yet I remind my team and myself, and certainly to you and your family, Bill, we have much to be grateful for. So even as this cloud seems to be around us, just being thankful for what we have and making the best of it is, I think, important. And yeah. Thanks for the time. I'm really curious to know what you call this, because we really have been all over the carousel.
Yeah, the title will be interesting. Yeah, I mean, we could title it digital, or we could title it. I have no idea where we'll title it. We'll see. But Tressa, thanks again for your time. I really appreciate it.
Well, always a pleasure, Bill. Have a great day and happy Thanksgiving.
What a great conversation. That's all for this week. Don't forget to sign up for Clip Notes. It's a great way to support the show. It's also a great way for you to stay current. If you're not familiar, Clip Notes is an email that we send out immediately following the shows, actually 24 hours after the show airs, and it'll have a summary of the show, bullet points, key moments from the show, and also 1 to 4 video clips that you can just watch. Great way to stay current, to know who was on the show and what was said. Special thanks to our sponsors, VMware, Starbridge Advisors, Galen Healthcare, Health Lyrics, Sirius Healthcare, Pro Talent Advisors, Health Next, McAfee, and Hillrom Digital, our newest sponsor, for choosing to invest in developing the next generation of health leaders. This show is a production of This Week in Health IT. For more great content, you can check out our website, thisweekhealth.com, or the YouTube channel as well. We continue to modify that for you to make it a better resource for you. Please check back want to check back. We publish 3 shows a week. We have the Newsday episode on Tuesday. We usually have Solution Showcase every Wednesday, and then an influencer show on Friday. But right now, we don't have any Solution Showcases, so we are doing we're dropping multiple influence episodes. So a lot of content being dropped between now and the end of the year. Hopefully you'll like that. And also we have the end of the year episodes coming up, and I'm looking forward to those. We have the Best of the Newsday show. So we take 10 news stories that we covered this year and give you some clips, give you an idea of what we went through this year. Obviously, COVID was the big story, but a lot of other things happened this year in the world of health IT. We're also doing a best of the COVID series itself. If you remember, we did 3 months of daily episodes, and we go back and we visit that time and just some of the wisdom that was dropped by the leaders during that. And then, of course, we do our end of the year top 10 countdown of the top 10 most listened to shows of the year. So you're going to want to stay tuned for that. We take a break the last 2 weeks of the year, and during that time, we don't stop dropping content. We just prepare it ahead of time and make it available to you. So hopefully you'll enjoy those this year as well. Thanks for listening. That's all for now.